Dr. Christina Tan, and to my far left, another guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. And today, I am further pleased to be joined by University Hospital's CEO and the former Commissioner of Health. This is the ultimate job swap here. I just want to say the two people to my right. At the far end, Dr. Sharif El-Nahal. Sharif, great to be with you again, as always. And to my immediate left, the CEO of the American Red Cross New Jersey region, Rosie Taravella. Rosie, great to have you with us. Before I go on, I will say not only do we have Director Maples with us, but we have Mary Maples with us, who's the General Counsel at University Hospital and former member of my team. To each of you, great to have you. General Counsel Chief Counsel Matt Plackett will be with us in a bit. Sharif and Rosie are here because University Hospital and the American Red Cross have entered into an exciting and promising new partnership to help us in our ongoing work to save lives from COVID-19. Today, we are announcing that the American Red Cross will be opening 2 convalescent plasma collection sites in North Jersey on Monday. One will be at the American Red Cross's Blood Center in Fairfield, and the other will be at University Hospital in Newark, New Jersey. In late March, again, let's go back a little bit here, the U.S. Food and Drug Administration announced an initiative to collect blood plasma from those who have recovered from novel coronavirus to treat patients with serious or immediately life-threatening COVID-19 infections. The plasma from recovered patients contains antibodies that may help others in their own fight against the virus. While this is a new advance against COVID-19, it is not a new practice. Convalescent plasma has been used before as a potentially life-saving treatment against quickly developing diseases and infections when proven treatments or vaccines were not yet available. University Hospital has been one of our hardest hit healthcare facilities and has treated a significant number of COVID-19 patients. Additionally, approximately 100 COVID-19 patients at University Hospital have been treated with convalescent plasma with promising signs. So to everybody out there watching, if you have recovered from COVID-19 and wish to be a plasma donor, please visit redcrossblood.org/plasma4COVID. Again, that is redcrossblood.org/plasma4, the number 4, COVID, for more information and to sign up. If you are eligible and qualified to donate, someone will get back to you to make an appointment. Additionally, other hospitals across the state have also begun their own plasma treatment efforts. COVID-19 hit North Jersey hard, and Essex County is certainly no exception. Essex has our 3rd highest total of positive cases, but also our highest number of deaths. The more we can attack this virus where its toll has been the greatest, the more lives we can save. This is a partnership that we are extremely excited about, and as we continue to follow the science, we know that it is just a matter of time before together we defeat COVID-19. So to you, Sharif and Rosie and your colleagues, including Mary, thank you again, and I know each will have more to say about this in a few moments. Now let's turn our attention to our overnight numbers. Yesterday we received an additional 1,759 positive test results for a current statewide total of 137,085. The number of new cases, as you can see, continues to show an overall positive trend, but where we are seeing the most progress is in the declining, as Judy always reminds me, the declining positivity rate. That is the number of tests which are coming back positive. This graph shows the daily positivity rate. Look at where we were not that long ago, Judy. It's hard to believe that. That's less than 5 weeks ago at the peak. And again, this is the positivity rates of the samples the day they are collected. This is important because when we report the numbers here, we are often reporting batches of results from different days. So being able to take a step back and look at results from a date certain is more insightful. As you can see, the daily positivity rate has been coming down steadily over the past several weeks. And for the latest tests, which we can assign a collection date to, in this case is May 5th, that rate has dipped to 27%. So we're making real progress. And here are another way to look at this, the daily positivity rates across regions of the state, and you can see how they are coalescing. The map that we've been regularly turning to keeps showing slower rates of spread across the state, and this continues to be a very positive sign, but I would say it's showing slower rates of spread, but too slow for my taste, or still too fast, rather, for my taste. In our hospitals, the number of patients currently being treated for COVID-19 dropped by roughly 130 from where it was yesterday, and it now stands at 4,628. And as we can see, the number of hospitalizations across our health systems regionally also continues to trend down. And the rates of hospitalizations regionally are on similar trajectories. And again, we saw more recently, Judy, as you pointed out, the South, this migrated, and you could see that migration in particular in the South. Our field medical stations reported 35 patients last night, and a reminder that the field medical station at the Meadowlands Expo Center is this weekend standing down and its operations transferred to East Orange General Hospital. And to you, Sharif, I want to thank you and the University Hospital team for your partnership, not just in coordinating all of our actions in the north where this hit the heaviest, but also for your partnership at the Meadowlands site. So thank you. Looking at our long-term care facilities, the numbers of positive cases, as you can see here, and deaths, tragically, connected to these facilities continues to grow. However, as we have noted before, we have put in place significant new levels of oversight and resources, and the New Jersey National Guard is deploying some of its members this weekend to several of these facilities to assist in mitigation. The number of patients reported in either critical or intensive care fell again yesterday to 1,416. Judy, you've thought this number, while it's getting better, let's go back to that if we could, is stickier than the number of hospitalizations. So it's going in the right direction, but not at the rate that I think you and I and others would like to see. And ventilator use continues on its downward trend with 1,054 currently in use, and all of us here are hoping that that number may soon fall under 1,000. There were 364 new COVID-19 hospitalizations yesterday, but there were also 422 live patients discharged yesterday, so we continue to see more patients leaving the hospital than entering. However, before you go on, I want to say this. Let's not forget, Judy would want me to say this, we're making a lot of progress. 364 people went into a hospital over the past 24 hours. We are not out of, with COVID-19, we are not out of the woods, folks. Let's not forget that. And here are the numbers broken down by region. And again, per capita, the number in the lower left in the South is the most troubling number, I think, for me, at least on the page. Because you've got a lower population and 130. Again, we're not shocked. Judy has told us this is going to migrate north, central, south. You can see it's not out of the woods in the north or central either, but as a per capita matter, that's a big number in the South. I was on with Kevin O'Dowd yesterday at Cooper Health, and he's done an extraordinary job, the same job Sharif's been doing in the north, and Amy Mansu in the central part of the state, Kevin has been doing in the South. And we have to keep these numbers all going in the right direction. And by the way, it's our collective job to do so. Social distancing is working. Wearing a face covering is working. Washing your hands with soap and water is working. And remember these 8 words. Public health creates economic health, and data determines dates. Let's not forget that. And the more we keep this up, the better position we will be to confidently and responsibly get ourselves on the road back, and we can begin to restart our economy. Before you flip, I just want to say we had a very good call this morning, as we do every 10 days or so, with legislators from both parties. And we went through some of the steps that we're looking at potentially taking, or in fact are taking. But again, we reiterate, the faster we can break the back of the public health crisis, the faster it is that we can reopen our economy. And we will do that at every step, as we have, based on the data, the science, and the facts. Sadly, with the heaviest hearts, today we must also report another one. Here, do you need the mic on for the feed?
It's on. It's on.
It's on. Thank you, Judy. Judy's not only our Commissioner of Health, but she's also our Chief Technician, and reminded me that my microphone, in fact, was already on. So that's a light moment, but we're going to flip, unfortunately, sadly, to a very tough moment. Again, another 166 deaths we're reporting. That number from COVID-19 complications, that number now stands at 9,116 fatalities. 9,116 fatalities. It's takes your breath away. I want to honor a few of those folks, but it doesn't look like we've got our, here we go. So let's remember several of those who have passed. First up, if we can, we'll go the other way. There he is, Jeffrey Lynn of my hometown, Middletown in Monmouth County. Jeff spent a career in purchasing logistics, most recently at Permapure in Lakewood. In fact, right up until he fell ill with COVID-19, Jeffrey was on the job procuring the supplies necessary for his company to produce tubing for ventilators. Jeff's family and friends knew him as an incredibly proud yet humble family man who went out of his way to make everyone around him feel welcome and to smile, whether with a silly joke or a funny story. He was a fan of both Frank Sinatra and Paul Anka, and for those of you watching at home, you may know that Paul Anka wrote Frank Sinatra's anthem, My Way, and he was often singing along with them at home. His daughter, Stephanie, who I believe lives in Philadelphia, summed up her father with these words, and I quote Stephanie, "He was the nice guy in the neighborhood, the sweet customer who regularly frequented Middletown shops, the chatty man in line at the grocery store. He made friends with any and everyone he met." He was, by the way, only 70 years old. He leaves behind his wife of 40 years, Carol, and please keep Carol in your prayers as she continues to battle. His two daughters, Stephanie, who I mentioned, and Victoria, with whom I had the honor of speaking. Stephanie, I believe, is in Philadelphia with her husband and with Jeff's grandson, who he also leaves behind. Victoria is in Middletown. Jeff also leaves behind a sister and other members of his family. We send them all our deepest condolences, and may God continue to bless the soul of Jeffrey Lynn. Next up, let's meet this guy. This is William Bill Schultz from West Milford, Passaic County. Bill spent more than 40 years within Sarah Supermarkets, and most of that at the ShopRite in West Milford. It couldn't have been all work, though, as it was there that Bill met his wife, right there with him, Denise, the woman who would become his wife 37 years ago. Together they would raise two children, Bill Jr., or Billy, and Jennifer, and I had the honor of speaking not only with Mom, Denise, but also with Billy and Jennifer yesterday. And he took special pride in being with his four grandsons, Billy, Nicholas, Michael, and Jackson. And when he would babysit them on his day off from work, there was nothing better. Family was everything for him. Well, almost everything. Bill was also an athlete and a huge sports fan, especially of my team and I were trying to figure out how we got these together, of the Yankees and the now Las Vegas Raiders. He loved music, he loved to cook, he loved the shore, and he was just 62 years old, and his wife, Denise, went out of her way to tell me that he was in very good health. So this is an example that while this has been ravaging older folks, folks with comorbidities, folks in communities that have historically been left behind, it has been also unsparing, even with some of the healthiest among us. In addition to Denise, his kids and grandkids, Bill is also survived by his dad, William Sr., 5 siblings and their families, and so many friends and colleagues. His memory, his soul, and all of them are in our thoughts and prayers today. And finally, let's remember, on the left there, a giant, Lillian DeMarco. Lillian was 90 years old and lived in the Lake Hiawatha section of Morris County. Lillian was born in Newark and grew up in nearby Montclair. She got married to her late husband, Paul, in 1950, and in 1960 they moved to Lake Hiawatha to a house Lillian would call home for the next 58 years. She was a proud telephone pioneer and spent her career with AT&T and Bell Telephone before retiring in 1990. Retirement for her didn't mean sitting back and taking it easy, however, and in her retirement, Lily traveled the world and volunteered her free time at St. Clair's Hospital in Denville, and she loved to read and to do word search puzzles. According to her family, Lillian was the happiest when she was spending time with her family and friends, especially if it involved a deck of cards or a set of Rummikub tiles. Lillian is survived by her 3 children, her daughters Catherine, who's known as Kitty, and Patty, and I had the honor of speaking with Kitty and Patty both yesterday, and her son Paul, in addition to their spouses and her 4 grandchildren. Likewise, we keep Lillian's memory and all of her family in our thoughts today. God bless you, Lillian. We remember Jeff, Bill, and Lillian because neither they nor any of the other 9,113 we have lost should ever be just a number. They were real people who lived real lives and who leave behind real families. They were each a treasured part of our New Jersey family. Our battle here is not just a battle to bring down the numbers, which it is. It is a battle literally to save lives. Remember that, folks. So keep practicing your social distancing. Keep wearing a face covering when you're out in public. Sharif and Rosie and others, Judy and Tina and their teams across our state are doing great work on things like developing therapeutics and cures. But the only surefire cure we have today, right now, is social distancing, staying away from each other. So please continue to do it. And by the way, we have led every single American state in doing just that, and we should all wear that forever as a badge of honor. Let's switch gears for a couple of announcements if we can. On Monday, the State Department of Education will launch an online application process for eligible districts to receive their shares of $280 million to cover the costs of purchasing educational technology, providing remote instruction, cleaning and sanitizing buildings, and ensuring support services for students who require them, among other, I might add, COVID-19 response-related expenses. Getting this funding flowing to our districts is a win for our schools, our educators, our students, and our taxpayers. I express my appreciation especially to the Education Commissioner, Dr. Lamont Repillette, and his team for working really hard to get this in place. I next want to give a huge shout out and congratulations to the team from Rutgers RU-CDR Infinite Biologics, who along with their partners at Spectrum Solutions and Accurate Diagnostics Labs yesterday received Federal Food and Drug Administration approval for the first at-home saliva-based test in the United States of America. This is a big step forward, and to know that it was made here in New Jersey with the support from our state's flagship institution of higher education is a great feather in our New Jersey cap. We all know that testing is a critical part of our getting on the road back, and the easier and more accessible testing is, the more secure we will be on that road. In fact, Monday, I think we're going to be able to do this on Monday. We're going to go through the whole testing plan going forward, Judy, and I think we've made another audible call at the line of scrimmage. I think we're now going to split testing and contact tracing because we think there's so much to go over in each of those respective areas that we're going to split them between Monday and Tuesday. I also want to return to a topic that I brought up on Wednesday, which is not COVID-19 related, but is of incredible importance to our state, and that is the census. Over the past 3 days, more of you have responded to our call to go to 2020census.gov to be counted, and our response rate has ticked up, but just a little bit, from 58.6% to 59.8%. We still, however, rank 21st of the 50 states, Washington, D.C., and Puerto Rico. I know we can do better. This map shows response rates across our counties. The darker the blue, the more of you who have already been counted. However, as the shades of blue go lighter, and in turn, shades of orange, These are counties that we need to see really start to step up. I'm going to return to this map occasionally, and I'll even point out some of the communities that are both at the top and bottom ends of the scale. But this is our starting point. Ensuring that every New Jerseyan is properly and accurately counted in the 2020 census is vital. The census is the data that the federal government and, quite frankly, we in state government use to make the decisions that impact every community in New Jersey. New Jersey was undercounted in 2010, and because of that, we have left literally billions of dollars in federal aid on the table over the past decade. And that undercount even impacts us today in our efforts to get more COVID-19 relief to our state. Folks, the money is there. If this money isn't coming to New Jersey, it's going to some other state like Kentucky. Let's make sure we get it here in New Jersey. So if you've not yet taken the time to be counted, please take a moment, go online to 2020census.gov and make sure you are. So much rides on an accurate count. Now, before I wrap, I want to give a couple of well-deserved shout-outs, but we're going to do things a little bit differently today. I want to give a big thank you to some folks who have been working directly with us in our response efforts, some in front of the proverbial curtain, and others whose work has been backstage, but in both cases equally as important. First, I want to give a huge thanks to the U.S. Army Corps of Engineers. Yesterday marked the Corps' last day with us, with regard to our efforts to expand our hospital bed capacity. In just 45 days, the Corps and the State Office of Emergency Management forged a partnership that assessed more than 20 healthcare facilities. Judy, you were at most of those, designed, as was Pat, and designed and built out our 3 field medical stations. It was able to reopen mothballed hospital wings, erect a 100-bed medical tent in the Newbridge Hospital parking lot, and convert the gymnasium there as well into a temporary hospital. The direct help of the Corps enabled us to quickly expand statewide bed capacity by some 1,400 beds. Now, the Corps is not going away entirely. They will now return to the environmental projects throughout the state that they had already underway, and in those, we look forward to our continued partnership. So to the U.S. Army Corps of Engineers, its leader, Lieutenant General Todd Semonite, North Atlantic Division Commander Major General Jeffrey Milhorn, and Philadelphia District Commander Lieutenant Colonel Dave Park and their teams, New Jersey thanks you. And to President Trump, I thank you as well for your swift response to our request to have the Corps deploy alongside us. I also want to give a big thank you to one of our corporate partners today, Microsoft. Throughout our response, Microsoft has worked alongside our Office of Information Technology to develop the healthcare volunteer signups in our hospital dashboard at covid19.nj.gov and to automate the reporting processes for bed and staff management, supply management, and discharge details. In these efforts, Microsoft donated both licenses and hundreds of hours. So to everyone at Microsoft who's been a vital partner to our information technology team, New Jersey thanks you. So as I turn things over to Judy, I just urge everyone to keep doing what you are doing. Tomorrow, as Judy has pointed out, and I will today, is Mother's Day. And on a sad note, New Jersey lost one of its great mothers yesterday, Mrs. Betty Wold Johnson, at the age of 99 years old, the matriarch of the Johnson family, mom to both Woody and Chris. So to them and to the members of the Johnson family in New Jersey and around the world, Woody is now serving as our ambassador to the United Kingdom. Our thoughts and prayers are with you. The first time I met Mrs. Johnson, it was nearing the end of the first half of a Jets game, and as we know, the Johnson family owns the New York Jets. And I wanted to walk over and introduce myself, and the person with me said, I think it was Tim McDonough, said, she'll meet you at halftime. She never wants to be interrupted during the game. And I said, okay, that is a leader. That is a mom. So to you, her memory, Mrs. Johnson, and to the Johnson family, our thoughts and prayers go out to you. But as a general matter, tomorrow is Mother's Day. And I know we all want to make sure we remember properly the women in our lives who have done so much and continue to do so much for us. But let's make sure we are celebrating them responsibly tomorrow so we can celebrate them again next year and the year after and for many years and decades to come. Happy Mother's Day, everybody. God bless you all. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichelli.
Thank you, Governor, and good afternoon. So as we prepare to celebrate